This is Pretty in Practice, the podcast.
Opinions expressed on this podcast are solely those of our own as well as our guests and do not reflect the views and opinions of our respective employers, organizations, academic institutions, committees, other groups, or individuals.
Greetings. Welcome to another episode of Pretty in Practice, the podcast. As always, we are starting today's episode getting to know the doctors a little bit more with our doctor's diary question of the day. So let's see what we got. Oopsies. All right, we're going to shake the bucket up. And what question do we have here? All right, friends. Okay, this is a good one. So, who do y'all think would die first if we were all in a zombie apocalypse?
Idiot.
I already know. I already know because I'm choosing me for me. Yeah, I'm not gonna make it.
So what you gonna do it in? You gonna just like curl up in a ball?
I'm just gonna give it to the guy. Like I'm not even gonna try. I'm going to lay down and allow them to take me. I'm not.
If she gives it to God, she may be the last one.
Right.
Yeah, my vote was also for India. I love you though.
I do.
I might try to fight them though. I might have some defense. Y'all think I can make it? Like with that?
I think you should try to run.
Okay. I'm gonna just go ahead and
But
stick
if
with
all else fails, fight or flight.
Yeah.
Fight.
it. Period.
Period.
That's it. Yeah, that's my vote. I'm sorry. I wouldn't want you to be the last one, but we're just talking about facts here.
You know, I'm not gonna make it, so don't put me in that situation.
But yes, thanks so much once again for joining us, you all. Today we're talking about a really deep topic and a really important topic, in my humble opinion, which is mental health. Obviously, very broad topic. However, there's a lot of things that I personally feel are very important to touch on in regards to this topic in general. Since we are very enthusiastic about just spreading awareness about health in general. We definitely don't want to only focus on the physical health of things, but we definitely, have to realize and understand how much mental health impacts us as a whole, and it does impact our physical health as well. Personally, for me, I really didn't understand how much mental health affected me until I went to grad school. I was stressed out in college and undergrad, as y'all know, but it was a different level of stress. When I was in grad school, and I remember for the first time, and I really haven't shared this with very many people, but I had a panic attack for the first time ever when I was in grad school. And I remember it like it was yesterday. I was in my car. I had an exam. It was either that I was preparing for an exam or I think I was preparing for the exam, because I think that's what had freaked me out. I was stressing about the outcome of the exam, hadn't even taken it yet, and I was driving and I felt my heart started racing. I had to pull over because, for safety reasons, I did not really understand what was going on, but my heart started racing. I started feeling like flushed, like I was gonna pass out. Pulled over to the side of the road, and I had called my boyfriend at the time, and I didn't want to call my mom because those of you who don't know, I am originally from Indiana, and I moved all the way to Florida for grad school. So I didn't want my mom worrying about me and not unsure what to do because she's thousands of miles away. So I called him and I told him what was going on and just started bawling, crying like uncontrollably, trying to get myself together. And he talked me through it and helped me to get myself balanced again. But that was so scary. That was so scary for me. And like I said, I had never had anything like that happen before. And that's when I kind of first realized that anxiety may be an issue for me. And that's when I started going to therapy. My grad school, they had free services because that experience, it was almost traumatizing, to be frank, because I did not know. Well, I'm in the medical field, so I kind of pretty much knew what was going on, but to hear about it or to hear people talk about it and then it happens to you yourself and you don't really understand what to do when you're in that moment, because it's a physiological response. And it's like you're trying to control yourself and you're trying to control your emotions and what's going on, but it's because it's physiological, you can't just sit there and turn it off just because you realize what's happening. And I think that was the scariest thing about it, and that's what made me realize that I had to figure out a way to deal with this. I had to figure out a way to deal with this anxiety because I wasn't quitting school, and there's always going to be things in life that that cause anxiety or cause stress and things like that. And so for me, that's when I kind of realized and understood how important it is to really take care of myself mentally, because if not, I wasn't going to survive physically, So that's something that I had experienced, and I know like all of us have been through school, and Dee, I know that we talked about this, and kind of dealing with that too.
So I had a very, very similar experience. So I guess grad school is clearly our triggers. So I actually did 2 different grad school programs. So the first program I did was in Charleston, South Carolina. I moved away. I moved away for undergrad too, but South Carolina is super far from Michigan, unlike Indiana. And mine was also caused by a test. So those grad school exams are hard. However, this one was different because I found out my test score. And it was a C, and if anyone knows, grad school, C's is like failing, essentially. And so it was the first time in a long time that I had quote unquote failed. And so I started panicking because I'm like, well, I went to grad school because I want to go to medical school. I just got my first exam back and I got a C, like I'm already not on the right track to med school. How am I going to prove myself? And so all of those thoughts just like started to crowd my brain, like back to back to back. And very similar to Lacey, it was the physiological response. Like I started breathing heavy, like I didn't know what was going on. I had never had a panic attack. I've never witnessed a panic attack. I've heard about them, but in that moment I didn't realize that was what was happening to me. Similar to Lacey, I also had a boyfriend, and he was actually a medical student, and he was like, oh no, you are having like an anxiety attack. And I actually went to a hospital because I couldn't stop it, because once I found out I was having an anxiety attack, I got more worked up. Like my heart was literally racing. I think when I got there, my heart rate was at like 169, and I almost passed out as soon as I saw it. They had to like turn the machine around to like get me to stop. Needless to say, thanks to those doctors, they, helped me calm down, helped me with my breathing techniques, but it was definitely caused by like that feeling of failure. And since then, test anxiety has been a thing for me. I have learned different ways to work through it. A lot of them are just like breathing treatments or self-affirmations. So just reminding myself like, you deserve to be here, you got this, you will pass this test, God is with you. Mine comes down to like self-affirmations, like during, before the exam, after the exam, just to keep me calm. So that's been my experience with anxiety.
That's tough. But I love that you said the self-affirmations, because I don't think that we understand how we feel about ourselves affects so many other things. Like I know y'all probably have maybe heard people say this, like if you think you're gonna fail, you're gonna fail, right. Or if you think you're gonna succeed, or something similar to that. And it's true. I mean, if you have a mentality that you're not gonna do well on something, then how can you actually do well on it? If you don't have it. And that's something that I personally struggle with, is my self-confidence, and really understanding that I do have the ability, and I do have the I am able to do these things that I want to do, but I'm sometimes my worst enemy and kind of holding myself back from that. And those coping strategies, I definitely fully agree with Dee on that you really have to talk yourself out of that mindset, out of that space. And I know, India, you were telling us, we've talked about this before, that you've had family members, that have suffered from anxiety, and kind of how they cope with that and everything. And I think that's important as well.
Yeah, it is. It's very important, because even though I've never physically had anxiety, I've seen it manifest in so many ways, and I have loved ones who go through it. And it's interesting that they tell you to look for patterns, but sometimes patterns are not always constant. Different things trigger it. And I really have to figure out, supporting my loved one, how to understand that it can manifest in different ways, and how, for me, how I respond to that, because I'm more of a go-getter, push through, you got it. And sometimes the person dealing with that anxiety, they don't want to hear that or need to hear that. And I've also learned that sometimes it's okay to ask them how they want to be supported. Whether it's me stepping away, whether it's me praying with them, whether it's me, taking them to a doctor, setting up a therapy session, just really getting their input of asking how they want to be supported is something that's been working for me, and having a lot of patience. People, one, have to realize and accept when they're having anxiety attacks or dealing with anything like that, but then they also have to go through different processes to understand what works for them. Someone could use a non-pharmacological technique of breathing, or stepping to the side, talking to someone, or someone else might need to actually have therapy, pharmacological therapy, in order to get through it. So just understanding that journey and understanding it's a process, and just being patient with people is something that I would definitely tell. If you're dealing with someone, you have a loved one who's going through it, you just really have to do the work on your end, and don't just expect them to push through, because it is a process.
Yeah.
I think you mentioned something really important, and it was that you have to know and understand that you have anxiety.
Right.
And I think that's the hard part, because I feel like I function at such a high level that I did not even think I had anxiety until it was to the point where I couldn't function high anymore.
Right.
And then I'm like, whoa, like this is probably anxiety. And then I realized, like, I probably always had anxiety. I just was able to function at such a high level that no one really noticed it, and then I didn't notice it either. So I say that I noticed, like, after PT school, when my life kind of calmed down, like from losing my sister in one try, then losing my mom 2 tries later, and then trying to push through the graduate. Like, I pushed so much aside, like I probably still was anxious, but it was very high functioning. Like, I still was able to pass my test. I still was able to get A's on my test. I finished my last semester with pretty much straight A's, but like my mental wasn't good, like, so, but I could still function. So like to society, like, they don't see that anxiety, but I really truly noticed it when I went home after I graduated and I had nothing else to focus on. Like, I did not have my textbook to turn to. I did not have boards to study for that kept me occupied, that I could truly realize, like, wow, like my brain is super overwhelmed by the thoughts. So I think it's very important to realize, like, you have to first even know, like, what anxiety is, because if you've never had it or known what it is, like, it's a question mark. Like, I don't know, like, I couldn't explain to you what anxiety is.
Like, especially it's different for everybody.
Yeah.
Like, it's different. But I agree with the high functioning anxiety. That is me. And then I also come from a family where, like, mental health is still stigmatized. Like, my mom is that push through, be strong, you better pray about it, stop being so weak. And I'm just like, Mom, we have to recognize that this is a real thing. Like, anxiety, I can push through, I can be high functioning, but like my mental needs to be better. Like, this is something I need to work on. So yeah, I think that's,
and it is okay. And that's another thing too. You can believe in God, and you can believe in the power of prayer, and still suffer from mental illness.
Right.
And so I think that, especially in our community, our culture, it is very much stigmatized, and especially if you do come from, a family that, a Christian family, or a family that believes in God, a lot of our parents and grandparents, it was like, mental illness, what, you don't have mental illness, you don't have anxiety. What is anxiety? What is depression? What is ADHD? Like, you don't have that, you need to pray about it, and so, just like, especially what you say, like, you have to do your research, and if you think you have a problem, go see a specialist about it. If you think you suffer from ADHD or ADD or depression or bipolar disorder, any of those things, the best thing you can do is to seek help about it. And if it's not what you think it is, great. If it's what you think it is, even better, because then you have the opportunity to really face it head on and get the help that you need. And I think another thing that you all mentioned is high functioning, mental illness, and that, I feel like, is something that we don't realize is so common.
Right.
We see people, and we think based on their appearance or based on their habits, oh, everything's fine with them, there's nothing that can be wrong. And I think that we really have to remember to check on each other. Whether or not you think that your friend is doing well, and social media has really just transformed things for us as a society, because we only post the good things. We post the pictures on the yacht, but we don't show, that it's a yacht display or something, like you're not even. No, seriously, I literally heard, this is kind of off topic, but I literally saw a picture and they were showing the behind the scenes, and people were literally taking pictures on a private plane, but it was a prop. It was an actual prop. And I'm like,
always real.
Yes, literally. And we're constantly comparing ourselves, which contributes to, anxiety, constantly comparing ourselves to what we see on social media, not even knowing if it's the real thing. And so we see people and we think they have it all together because they have money and they have this and they have that. And you don't know what people are going through. You really don't. Even your friend that you think you all are, so close, and they would tell me if they were going through something. They would tell me if they were bothered by something. No, not necessarily, and I think we just really have to be diligent about checking up on each other. Are you good? In hearing that, not just hearing the words that they're saying, but hearing the tone in their voice. Like, I can tell you right now, if I asked any of y'all, are you good? I could tell in your tone of voice, are you actually good? Or do I need to pry a little bit more? Do I need to ask a follow-up question? And that's something that we have to remember too, is because everybody is not going to be just open necessarily. You may need to pry a little bit and get a little bit more out of that friend and really find out, well, you good? Yeah, I'm all right. No. Are you really good? Do you need to talk about something? Do we need to go to coffee? Do we need a FaceTime date? And those are things that, I feel like that, because our lives are just so busy and all the hustle and bustle of everybody having their own lives, I think sometimes, we kind of forget that sometimes we need to do that. We need to go the extra mile.
I'm gonna double down on that, and I'm gonna say, especially your strong friends. They say check on your strong friends. I will tell you right now, all four of us, especially Justice, is that strong friend who's always gonna push through. We could be literally drowning in the water, and we're gonna figure out how to save you in the boat that you're on your yacht. And we're over here in the water drowning, and we're that strong friend who's always going to push through because of how we were raised, and also being Black women. We have to do 2 times, 3 times, 4 times the work in order to even be on an equal playing field. So really, like Lacey was saying, is just having that intentional conversation. Don't just do that, oh, hey, how you doing today, and keep it moving. Really pry in. I know I am nosy with y'all life. I will make y'all talk about stuff that y'all don't want to talk about, but it's just really showing somebody that you care, and that goes a long way.
It does. Cause just will not ask for.
No, I will say though, like you said, you do have to ask and you do have to pry. Cause I'm probably not gonna tell you, but if you ask, I probably won't tell you. Yeah. If you don't ask, cause you expect me not to say it, then we just never gonna talk about it. Cause I'm fine with carrying it. I've done that, so that's normal to me. I don't expect anyone to listen, cause that's just what I've
But when somebody does listen, you talk. You really
and I will. So that's what I'm saying. So you definitely do have to ask. And you never know until you do. Cause
right. Yeah. Exactly. Cause she's right. If we you will definitely express yourself to us. And I'm really they know I'm probably open. I'm very emotional. And that's it can be a good thing and a bad thing, but just like with anything, you can have too much of a good thing. But even the emotional friends, or the friends that you feel always express themselves, you never know what people are going through, and they may not feel comfortable, and I even think of just kind of changing topics a little bit, is how some people are just not, some people are embarrassed to talk about having mental health issues, maybe it's because they are used to being the strong friend, or maybe it's because it's just the stigma around it. And I think, especially because we're all in the medical field or going into the medical field, I think it's important to touch on the fact that mental health is it's almost taboo of a topic for a for a healthcare professional to have struggles with mental health. And it honestly, it's so backwards to me, because any field of medicine that you go into is very challenging to get there. Whether it's nursing, whether it's occupational therapy, physical therapy, medicine, pharmacy, whatever it is very challenging. And so it's so backwards to me how much, how taboo almost it is to talk about mental health, because you feel like you're going to be judged because you're a healthcare provider. But everything about becoming a healthcare provider puts everything in your face in terms of you're not sleeping, trigger for stress. You have exams that cover 1,000 topics in one exam. Stress causes stress. You are losing, time away from family and friends, causing stress. So it's just crazy to me, like, that we're just in a society, and it's getting better. Like, that's what I'm seeing. It's getting better. Like, social media is actually helping, in my opinion, in that way, where people are sharing their stories.
There's power in vulnerability.
It is.
And I think as healthcare professionals, when our patients or whoever we are serving sees that, we are normal people. We are not superheroes. We're not superwomen. We are people. And sometimes we've had the diseases and the disorders that they have had. So we know from a first-hand basis, we're not just telling you something that we read in a textbook. We go through it too, and we're not going to give you advice that's going to be detrimental to you, because we go through some of the same conditions. So just being open as a provider, and that's something that is very important to me, that I try to preach. I try to make sure that any patient that I interact with does not see me as a superior figure or anything like that. If there's something that I'm going through and I feel comfortable talking about it, I want to make sure that I put it out there for my patients. Do you guys think, in practice and clinic, whatever you're going through, that you guys have a similar type of thought process?
100%.
Definitely.
I'm very, very blessed to go to clinic as a first-year medical student, which I'll talk about in another episode. But seeing patients on a weekly basis, like, I have literally seen their eyes light up when I walked in the room. Like, I've had patients tell me, "Oh my gosh, you're the first Black doctor I've seen." I'm like, wait, I'm just a medical student. Nevertheless, we're gonna get through this together. And like, it's so reassuring and so fulfilling, because I'm able to literally empathize with what they're going through. And I feel like it just makes the overall experience for the patient so much better. And then speaking to it getting better in general, I will say that the school I attend, I'm very grateful, because they provided us with 10 free therapy sessions per semester. That's completely paid for, with like a super dope therapist. She's Puerto Rican. It's amazing. And I've been tapping into that resource, because I'm like, no, we don't talk about it in class as much, but we do have that resource available for us. And so, I mean, we're in med school, so we can always afford to go out and get therapy.
Oh, yes.
And it is frowned upon to get like treated for certain mental health issues, which is insane to me. Again, that whole taboo thing, it's crazy, but I would say my school is being very progressive about how we're dealing with that.
I love that. I love that. And I hope that other schools follow suit. I hope that it becomes more of a norm to take care of yourself. Because the thing is, like, we stress it so much. Get a primary care physician. Make sure you're getting your yearly checkups. Go to the dentist. Make sure that, you're getting your yearly or bi-yearly. I don't even know if that's a thing. Twice a year. Biannual. Oh, there we go. Getting their cleanings twice a year. But when someone mentions having a therapist, you have a therapist? Or why? Yeah. Like, what's going on with you? Like, you got a you went to therapy? You going to therapy now? Oh my goodness, what's going on?
And it's
like, no, I'm nothing. I'm just this is a maintenance appointment. I don't necessarily have to have something going on. And even if that were the case, I'm getting help for it. I'm getting help for it. And I think that really that's what it comes down to. It's not about whether you have the illness or not. It's about congratulating you that you have acknowledged it and you're getting the help that you need. Just like if you were suffering from any other physical ailment, we would be congratulating, oh, I'm so happy that you had that surgery that you needed, or I'm so happy you got that hip replaced, or whatever the case may be that you needed. But then when it comes to somebody going to therapy, we're not, you know, as a society, as a culture, we're not getting that same, you know, congratulatory tone. And like I said, you know, before, we're getting there. You know, things are definitely changing. I love the fact that your school is doing that, though, because you touched on it, that affordability. You know, I'm hearing a lot of, I follow some mental health therapists or therapists on TikTok, and a lot of them are saying, you know, how they're not going through insurance anymore because insurance, it's a pain getting insurance to cover a mental health visit unless you're diagnosed with an actual diagnosable mental health condition. And they're, you know, trying to make it more affordable, because I just don't think that you should have to necessarily have something to, you know, to go to a therapist and talk about things. You know, you could do it to prevent you from, you know, developing that. So
I agree.
That's just, you know, that's just my 2 cents
And
on that.
even if you do, like, it's just like you have to show proof. Like that it's always that formal diagnosis. Like, I've had family members struggle and have things like, oh, we're going to take funding away from your school, or like you said, insurance, if you don't have this formal diagnosis. And sometimes it takes people a while to even acknowledge that. So it's just like giving grace when people are having any type of breakdown, any type of mental things. Like, I think there should be more proactive and willingness help to make sure that people get the help that they need, even if they don't have a formal diagnosis in the chart.
Right, exactly. And there are programs out there, you know, I hear about programs that, you know, are trying to make things more affordable, make mental health visits more affordable, more accessible. You know, I think that COVID, you know, a lot happened with COVID, a lot of, you know, definitely very challenging and difficult things. So one thing that I can say was a positive that came out of it is the increase of, you know, at-home visits, or being able to see a physician or being able to see a therapist from home. I know that was a thing before, but it definitely was heightened after, you know, once COVID hit and everything, and then, you know, us still dealing with it. It's definitely something that I am appreciative, at least from, you know, everything else that came out of it, is that we are trying to increase the accessibility by having the at-home visits and things like that, where you can meet with your therapist in the comfort of your own home. I know I was talking to somebody, and their therapist is located in a completely different state. But, you know, they have that relationship and they have that bond, and they appreciate the fact that they can see their therapist on the regular without even having to leave their home, let alone travel to an entirely different state, you know, just to see someone that they've made a connection with, someone that they, you know, really appreciate and are doing well with. So I think that that's, like I said, one good thing I can say, you know, that has come out of all of that. Well, that wraps up today's episode. We thank you guys so much for joining us once again. Be sure to tune in to our next episode. And always remember, no matter what you're doing in life, always keep it pretty.
As always, thank you for joining us for the ride. Be sure to keep in touch by following us on Instagram and subscribing to our YouTube channel at Pretty in Practice. Feel free to send us a DM of any topics you want us to discuss, and you might hear them on a future Pretty in Practice episode. Keep it pretty.